my parents, Meenaji, and we've got Rohitji as well. Thank you for joining us. We'll have a bit of a question answer session at the end, but I'll start with my blog first. So, the name of the blog is the JAK and STAT Pathway and the connection between the treatment of severe COVID-19 and anti-cancer and anti-inflammatory diet. So that is the topic of today's blog. So, baricitinib or Olumiant, which is a Janus kinase 1 and 2 inhibitor, it made the news recently. A few weeks ago, it received FDA approval for treatment of severe COVID-19. It works on the JAK-STAT pathway. JAK stands for Janus kinase. STAT stands for signal transducer and activator of transcription pathway. How it works is by dampening down what we describe as a cytokine storm. Cytokines are signaling molecules within our body which increase inflammation, particularly when you're fighting a foreign virus like COVID-19. And this particular medication, it reduces the transcription of certain pro-inflammatory cytokines like interleukin 6, interleukin 2, interleukin 8, tumor necrosis factor, etc. So it appears to have a stronger dampening of inflammation effect than targeting individual cytokines, such as using tocilizumab for IL-6 inhibition. So last month, baricitinib received emergency use authorization for use in severe COVID-19, and here we have the FDA's letter of approval for this drug. This drug is made by Eli Lilly, so it is the US FDA writing to Eli Lilly, telling them then that they can go ahead and under these situations, it can be used for severe COVID-19. Now, there are two main trials that the data is based upon. One is an observational study, and the other is a randomized controlled placebo prospective double-blinded trial called the ACT-2 trial. In that trial, because this medication was used with antiviral agent remdesivir, for that reason in the US it's only licensed to be used with remdesivir. However, many people following COVID-19, including myself, feel that this medication has wider benefits than using it just with remdesivir. So here, of course, there is a description of how baricitinib is a Janus kinase inhibitor. Currently, this drug is licensed by the FDA as a third-line medication to treat rheumatoid arthritis. As you may well be aware, rheumatoid arthritis is a chronic inflammatory condition of the joints. First line, you tend to have drugs, what we describe as DMARDs, disease-modifying agents, typically hydroxychloroquine, sulfasalazine, methotrexate. Second line tend to be drugs like infliximab, which is a tumor necrosis factor inhibitor, and baricitinib at this time is third line for rheumatoid arthritis. Here you can see it's been licensed to be used with remdesivir and also in severe cases. Patients requiring generally oxygen, ventilation, or ECMO support. So that's the FDA authorization of baricitinib. This drug is available in India and all across the world. The brand name, I looked it up. In India, you can get it as 4 milligram tablets, and I believe it costs about 21,000 rupees for a 7-day course of this medication. It's generally a once a day tablet. It can be crushed and put into a NG tube if patients are unable to swallow, typically patients who are ventilated. So the ACT-2 trial. Well, ACT-2 trial is, these are trials which are being conducted by government authorities, it could be said. And NIH has been helping with that. And so if I show you the ACT2 trials, these are being done in the US mainly. The ACT1 trial was done on remdesivir, and remdesivir was FDA approved based upon this trial. The ACT2 trial looked at remdesivir with baricitinib. Currently they are recruiting, they have ACT3 trial going on, in which they are looking at interferon beta alpha 1A. Not looking too positive for that, because the solidarity trial didn't show very much benefit for interferon beta, saying that solidarity trial by the WHO didn't show much benefit from remdesivir either. And then they're also recruiting for the ACT4 trial, in which they are again looking at remdesivir, baricitinib, along with dexamethasone. On a personal note, I wish the NIH would listen to groups like the FLCCC and consider a repurposed drug such as ivermectin for these large trials. So the dosage is 4 milligrams a day, once a day for 2 weeks until hospital discharge. There are some risks. It can cause a transient rise in liver enzyme levels, and it has to be used with caution in end-stage kidney disease or dialysis. In fact, for dialysis, it's a contraindication. There are some risks. Blood clotting can be a risk, also infections, because it dampens the immune system. But it is anticipated most patients who are on this medication will already be on antivirals, antibiotics, and anticoagulants. So hopefully that risk can be mitigated by use of these medications. There is another Janus kinase 1 and 2 inhibitor which is being investigated for COVID-19 in Germany. So I have a link here for that other Janus kinase inhibitor. It's called ruxolitinib, and as you can see, it is currently recruiting the trial for use for COVID-19. It will be a moderate-sized study with about 200 participants. For anyone who's interested in looking at trials, clinicaltrials.gov is by far the best website. Just do a search for whatever medication you're interested in, and you can get a list of all trials which are currently recruiting or have been completed along with their study results. So here we talked about the Janus kinase pathway. What is the Janus kinase pathway? So if this is a cell, this is the cell membrane, this is outside the cell, this is the cytoplasm, and this is the inside nucleus, the core of the cell. There are 4 types of Janus kinases, JAK1 up to 4, and then depending on what's happening outside the cell, so in the case of a viral infection, you would have viral debris, you would have a fight going on between your immune system and the virus, you would have inflammation, you would have oxidative stress, and they would then mediate certain types of receptors, which is your JAK receptor, and then that would then lead to transcription. That signal would go to the nucleus, it would have an effect on your DNA. Your DNA would then transcribe certain kinds of pro-inflammatory cytokines. It would produce proteins. Proteins would come out to the surface and produce cytokines. And so this is how your cell reacts in a pro-inflammatory method to what's happening outside. So this whole thing can be dampened when you inhibit certain parts of the JAK pathway. And JAK1 and 2 are particularly good targets for this because they tend to be mediating most of those pro-inflammatory ones, which are interleukin 6, 8, 1, tumor necrosis factor, etc. So now I would like to take a bit of a turn with this talk, and this is where you may start finding some interesting correlations, because the JAK-STAT pathway is also an anti-cancer pathway. We also use certain types of chemotherapies and other kinds of therapies are targeting this pathway, because that chronic inflammation can also lead to cancer. It can lead to tumor growth. It can lead to cancer in the first place, de novo. And next, I would like to discuss this paper in which they talk about dietary phytocompounds which reduce cancer and tumor growth and have been shown to inhibit the JAK-STAT pathway in cell studies. And most of these cell studies you would find are in cancer cells. They could be lung cancer cells, liver cancer cells, other kinds of melanomas, lymphomas, those kinds of studies. So let's have a look at that study. Here we are. So this is a study in which they studied several dietary phytocompounds which can be used for cancer prevention. Now, when we say cancer prevention, we also mean inflammation reduction. So reduction of inflammation has more benefits than just cancer. You can reduce insulin resistance, you may reduce diabetes. A lot of things can be reduced. And you can reduce your risk of severe COVID-19 as well if you reduce the underlying inflammation. So let's have a look at this paper now. Here they talk about how cancer is a major problem, how inhibiting the Janus kinase pathway is well known to be of benefit. It's a very detailed paper, and I quite enjoyed reading this paper yesterday. It talks about the JAK kinase pathway. It's got some diagrams here. It talks about the different types of pathways. STATs can be all the way from 1 to 6. JAK we know is from 1 to 4. So you can see it's a well done paper. So if we now start talking about the dietary kind of compounds. So here they talk about this particular compound, which can be found in peanuts, berries, and grapes. It inhibits IL-6, which we know we have been targeting. Here they have diagrams of various of these compounds, and some of these you will start recognizing already. Curcumin is haldi, turmeric. Cardamom is elaichi. And we'll go through these one by one. So curcumin also inhibits the JAK-STAT pathway. If you go through this one here, there are a few others, and I will go through the ones which we are kind of more interested in, because these are things that we commonly come across in our daily diets. EGCG is present in green tea. This particular one is present in these kinds of foods. Rhubarb, for example. Chalcones are flavonoids. Flavonoids are like quercetin. Quercetin is also a dietary flavonoid. Orange, strawberries, tomatoes, certain vegetables like bean sprouts, shallots, and potatoes, and certain spices like licorice. This particular dietary compound is found in beans, carrots, cauliflowers, lettuce, red potatoes, and green peas. Cardamom is a spice we often use in India. Also inhibits this pathway. Caffeic acid is caffeine. You can found in wine, tea, and coffee. If you look at this one here, there are variants that I haven't actually discussed in detail because they're not commonly found in our diet. But the ones that I have that are found in our diet commonly, I have mentioned specifically on my blog. So if we move over to our blog, this one here is a type of vitamin E. Again, you'll find a common kind of theme that, generally speaking, things which are natural, fruits particularly, and herbs and spices, this is where you get all the goodness. Here we are. Thymoquinone. We talked about this last time. Nigella sativa is kalonji. So kalonji is also on the list. We already found curcumin and we found elaichi on the list. Curcumin is in there. And this one I believe is methi. Methi is there as well. Of course, we all know capsaicin. Capsaicin is peppers, chili peppers. So, if you just quickly, this is also commonly used in Ayurvedic medicine. Google, in English it's called Guggulsterone. This particular one is found in flax seeds, in berries. Flax seeds are often used in Western traditional medicine. So the conclusion of this paper was that there are many things in our diet which can also inhibit the JAK-STAT pathway, reduce inflammation. This particular paper was more about cancer prevention, but I would say you could also extend that to prevention of chronic inflammation that can lead to sugar diabetes, other kinds of insulin resistance, and other kinds of metabolic syndrome related complications. So, quick recap. Curcumin is healthy. This particular chemical is in peanuts, berries, and grapes. This particular chemical you can get in grape juice, lime, lemon, and bergamot oil. Oranges, strawberries, tomatoes, bean sprouts, and spices such as licorice, beans, carrots, cauliflowers, lettuce, green peas, red potatoes. Cardamom is elaichi. It was shown to be a STAT3 inhibitor within brain cancer cells. Caffeine we find in wine, tea, and coffee. This one you find in a variety of essential oils as well as fruits. This is kalonji. It again showed STAT3 downregulation in human gastric stomach cancer cells. This particular you get in essential oils mostly. Capsaicin is chili peppers. Diogesin, that is methi. And it also showed inhibition of STAT3 inhibition and also by IL-6. IL-6, as we know, has been a major target for Covid-19. This one is mostly found in flax seeds. Quercetin is part of our treatment protocol, in fact, is found in kalonji, strawberries, apples, and onions. So the summary of today's talk is that chronic inflammation in our body has several negative impacts, and there are healthy lifestyle choices we can make along with reducing stress, sleeping well, maintaining an ideal weight, exercising more. But there are also certain dietary choices we can make which will help us in reducing chronic inflammation within our body. And I'm hoping that more and more people will share this blog and this video and help other people make those positive life choices. As to how you found the talk and any questions you have. We are live on Facebook and YouTube. Any people who would like to comment, I will be able to see your comments and I'll be more than happy to respond.
Thank you. Thank you so much. Thank you so much, Dr. Sabang. Very informative talk. God bless you.
Thank you.
About remdesivir, if I'm right, WHO had also ruled out that it doesn't have any benefits.
Yeah, so the WHO does not support remdesivir, but so fewer people are now using remdesivir. The problem with remdesivir, in my mind, is it is an antiviral agent. It does reduce viral replication. However, because it is intravenous, because you have to give it in a hospital, by the time anyone gets into that phase where they need to be hospitalized, it's too late for that to have much effect. because we know that the first 7 to 10 days is when you have viral replication. And after 10 days, most patients are not even infectious anymore, unless they are immune suppressed. Most patients are not even spreading the virus and don't have multiplying virus. It is then the inflammation, and that's what we'll be talking about today, the JAK-STAT pathway, other modes of inflammation, and blood clotting, which then becomes life-threatening for those patients. And so giving an antiviral at that time may have some benefits because, in case the patient is immune suppressed, then they may have less, they may be more susceptible to viral replication if it hasn't completely stopped by then. And secondly, you are already giving them steroids by that time. Steroids will also have a further immune dampening effect. You may even consider them for baricitinib, in which case adding in an antiviral plus, I would imagine, a broad spectrum antibiotic probably has some benefits. But I think the main problem that remdesivir had was that it was given too late, because it's given at a time when the viral replication phase is finishing and you have the inflammatory phase and thrombotic phase starting at those times.
Second question. Now that some countries, at least two countries, have already given approval for Pfizer. So, in case people fall sick of this disease, will they be given that vaccine, all
Yes.
these things?
Yes, so the recommendation is that patients who have been sick with COVID-19 should still get the vaccine. Although, in my mind, those patients should not, in public interest, be front of the queue. Those patients should probably be behind in the queue because they already have their antibodies. If they have recovered, they have antibodies. They will have them for at least 6 months, I would imagine. And so they should probably be back in the queue, not in the front. But the recommendation is that they should still have vaccination.
I'm talking about the new patients. When new patients come up, will they be given that vaccine, or all these uh,
No, vaccines are too slow for that. Vaccine, you have 2 doses about 3 to 4 weeks apart, and then
okay, okay,
the
okay.
immunity then develops a week or two after that. So it takes about 5 to 6 weeks to develop immunity. In that situation, you give antibodies. So you give the end product of vaccination early. So that's what Donald Trump received. He received an antibody cocktail, and that's what we do for rabies, for example. So when you get bitten by a rabid dog, you don't have time to have vaccination for rabies. So you're given that course of injections, which is antibodies, not vaccine. So essentially, when we treat someone who gets bitten by a dog, it is antibodies, not vaccine.
Hmm.
The way you are saying,
I was sorry. Carry on, please.
उसको mute करना
Ha,
ही
Shaji, carry on. We can hear you. We can hear you.
yes, what I'm saying that when they a lot of people have to go to the stage of ventilation, but didn't they get the treatment like Donald Trump got, or is it very expensive or what?
Yeah, so the treatment he got, I mean, he got lots of treatments. He got a lot of things from our protocol. So he received melatonin, famotidine, aspirin, vitamin C, vitamin D, zinc. So he received a lot of things from our protocol. But he also received remdesivir, which is actually only licensed for low oxygen levels. So that was a bit early. They said he had one dip of oxygen overnight, but no one really knows if that was true or not. I mean, if your oxygen meter slips off your finger, that'll give you a dip in oxygen levels.
Mhm.
And he received the antibody cocktail. Now, as we mentioned before, a lot of these treatments are injectable treatments, and the biggest downside for them is that they have to be given early to be effective. For most viral conditions, be it chickenpox, shingles, we have to use the antiviral within 2 to 3 days. But by the time you get to hospital, it's already been 10 days. The virus has stopped replicating by then. At that time, it is more inflammation. The steroids need to be given for that. JAK-STAT inhibitors may be required for inflammation. Anticoagulants are required for blood clotting. But antivirals don't have that much of an effect at a later date. But Donald Trump was lucky. Within 7 days, he was airlifted into a hospital and he received antibodies and remdesivir. But most people would not receive that level of treatment, because in the U.S. yesterday there were 220,000 new cases of COVID-19, and you cannot put them all into a hospital and give them injections and drips. So that level of treatment is just not available. That's why we are promoting our protocol for early treatment, where you can use naturally occurring antivirals as a mode of reducing your viral load, and hopefully reducing your risk of moving on to a more serious case, as happens in 15 to 20% of cases. I'm happy to report so far I've treated over 30 patients. At least half of them were over the age of 70, had multiple risk factors, and no one from my caseload so far has needed to be hospitalized. In fact, no one has even had chronic long-term symptoms of COVID-19. And so that is what we're propagating. We're propagating early treatment. And I'm one of the very few number of doctors, Dr. Paul Marek and FLCC Alliance from East Virginia, Dr. Peter McLeod from Texas, there's a doctor from Australia as well. So we're a small group of physicians who are advocating early treatment. Otherwise, 99.9% of what you will hear from other doctors and from all your authorities, be it ICMR, Health Canada, or CDC, is that there is no treatment for COVID-19. You just have to sit at home and hope for the best.
Thanks.
Ashish?
Thank you, Dr. Sapan. Once again, every week you bring a new topic and teach us and keep us well informed. And I think it's worth to get up early and attend your session. And again, today, I learned something new that, through naturopathy also we can deal or inhibit those cytokines or cytokines. Now, you mentioned something about FDA approved a drug to be used in US, which is similar to the inhibitors which are used in cancer treatment. Is that kind of drug approved here in Canada also? And I think it's a good thing if it's approved, then hospitalization will go down and the stay in the hospitals, I think the time will reduce. So just would like to know from you.
Yes, it has been approved in Canada as well, Ashish. And this drug is available in India as oral tablets. Like I said, about 21,000 rupees for a 7-day course. And I would really urge, especially for this talk, to be shared as widely as possible, because today there are 100,000, and there's 100,000 patients in the US admitted because of COVID-19. And there are probably tens of thousands in India as well. And we need to make people aware of this new drug, which I believe could be groundbreaking. Of course, as we mentioned, there are certain risks. It is really licensed to be used alongside antivirals. The license in US is along with remdesivir, along with anticoagulants, because there is an increased risk of blood clotting, along with broad spectrum antibiotics, but there is a risk of more infections. And generally speaking, anything that you do to reduce your body's immunity will generally increase risk of infections, be it steroids, be it infliximab, TNF inhibitor, be it baricitinib, JAK-STAT inhibitor. So it has to be used in the more critical patients, but certainly if there are patients right now in India who are, let's say, on standard treatment with a blood thinning agent, with perhaps an antiviral, it could be ivermectin, maybe remdesivir, on some kind of broad spectrum antibiotic and steroids, then they should be considered, if they're not improving, for baricitinib as well.
Your words are not clear.
Yeah, I'm getting double sound as well.
And Dr. Sapan, just curious, are these cytokines, they are same kind of cytokines produced by COVID and cancer, inflammation, and other diseases, or they're different one?
Well, there are multiple cytokines, but there are certain more notorious ones. So TNF, or tumor necrosis factor, IL-6, interleukin-6. These are more notorious. We know they are very well matched with a bad kind of inflammation. We know that we need some good inflammation as well. I mean, there is inflammation is there to protect us. So it's not that all inflammation is bad, but when the balance gets skewed, you have to then rebalance yourself.
Thank you.
Thank you.
Well, thank you everyone. That was a nice, short and sweet talk. But I would like to put out a special request for this to be shared as widely as possible, because I feel that when we're talking about treatments for severe COVID-19, there are lives which today could be saved if people are made aware of this new drug. But not just for using JAK-STAT inhibitors in severely ill COVID patients. Make them aware of our protocol where we are using early on at home treatment several medicines which are also antiviral and JAK-STAT inhibitors. So we talked about curcumin, turmeric, haldi. We talked about quercetin, which is in kalonji and other foods. We talked about methi. We talked about elaichi. So these are all health foods that we can choices that we can make. And of course, we talked about fruits and vegetables, berries, and those kinds of things that we can make to reduce the inflammation in our body. Of course, when we make these healthy choices, we also need to reduce those kinds of food items which tend to increase inflammation. So that would be primarily sugars and carbohydrates and trans fats, so bad type of fats, fried things. So reduce those kinds of foods, which you can describe as pro-inflammatory. Increase the anti-inflammatory foods, and hopefully we can all be in a better situation if and when this virus comes in the short term to reduce our risk of COVID-19 severity, but in the long term also to reduce risk of cancer, for example, and other kinds of metabolic conditions. There's only one person I haven't heard a question from, which is Meenaji. So do we have Meenaji with a question? And Mummy, perhaps you could ask a question as well.
Yeah. I got all answers from you. I got everything. Thank you so much. And I'm using kalonji, methi, elaichi, everything daily. We are using.
She's
So
super
thank you
doctor.
so much.
Super doctor.
Meenaji.
Everything.
Doctor's mom,
Thank you so much.
Naturopath.
So, Sapan, all these things which you mentioned, they are also in Ayurveda, like holistic, like they also, everyone tells us to eat, ginger and cinnamon. And so I was just thinking about that. There are so many similarities in both. So it's good you
That's
revised it
correct,
and
and that's why
you
when
gave
you have trials, when you have studies like this one here, you can see it was done primarily by Indian doctors here, so in India.
Mhm.
But what they're doing is, and I've seen studies by Chinese doctors as well, where they are studying traditional medicine, and the idea is that traditional medicine, be it Ayurveda, Unani medicine, Chinese medicine, these are places where you go fishing for your next scientific drug, because these are derived from tens of thousands, well, over 5,000 years of experience. And so you know that there is something there which is working for those people. But often we don't know what it is. And so often when scientific researchers are looking for that next drug for cancer, for other kinds of conditions, they will go fishing where there is some signal from Ayurvedic medicine or Unani medicine or other kinds of traditional medicine. So this is what is commonly done. And I would like to say that scientific medicine is all about just refining it, and we need to learn as much as we can from these traditional medicines, because you can't discount over 5,000 years of human experience. If that had not worked, people would have stopped doing it thousands of years ago. But if they're still doing it after 5,000 years, there is some human experience there which we have to respect and learn from and try to refine even further. And that's what all these researchers are doing.
And what is the reason? Like in United States is the first one, top one to get the COVID cases, and second is India. But when you see the death rate is a half in India, what could be the reason?
Yeah, there are many theories around that. I mean, there will be one group of people who will say that the death rate in India is actually not true. They are not counting properly. That there is some truth in that as well. It is not as systematic in India as it would be otherwise, but there could be some truth in that, and there are many theories. One theory is the hygiene theory, and there was an article on BBC about this, and I happen to believe in this theory that particularly among the poor people, people living in slums, for example, or people who are farmers, one, they don't have that much inflammation in their body because they're not overweight, they don't have diabetes, they are fit, they are active, they are working hard. Secondly, they are exposed to a lot of infections, so they have dirty water, dirty food, malaria, typhoid, dengue. So all of these challenges to their immune system. So on one hand, the inflammation is down. On the other hand, the immune system is like a well-primed army. So their immune system behaves like a child's immune system. Children get hardly any problem with COVID-19, and we don't know exactly why. We think it could be because of they have more certain types of cells called natural killer cells. It could be because they get more live vaccinations like BCG and MMR-V vaccination. It could be because they get recurrent viral infections when they go to school and daycare. They're sick every 2 to 3 months with a cold or sniffles. There could be some degree of cross-reactivity with the common coronaviruses, the common cold coronaviruses. There are 4 strains which circulate and give us coughs and colds. There might be some cross-reactivity there. And there are certain things which happen as we get older. Our amount of melatonin goes down. Our amount of coenzyme Q10 goes down. So there could be some certain protective chemicals which naturally go down as we get older and could be putting us at a disadvantage as we get older. So these are all theories. None of them has really been validated. But I feel that there is a hygiene theory aspect as well. And thirdly, I mean, we have to admit treatment of COVID-19 is much more aggressive in India than it is in the US. I mean, sad to say, treatments that we've often been talking about, such as ivermectin, which is a repurposed antiparasitic being used as an antiviral, is now commonplace in India to be used. Although it is only part of the protocol in 4 states, UP, Assam, West Bengal, and Goa, it is actually being used around over the whole country. There are other things, high-dose anticoagulants, slightly earlier initiation of steroids. And so treatment generally, because the regulation is not as strict, the physicians can be a bit more flexible with their treatment. And it is a bit of a sorry situation, actually, if you think about it. Generally speaking, you would think that better regulated health systems would do better. But in this situation, less regulated health systems have done better. Because what can happen in less regulated symptoms, you can treat the condition like I'm recommending. For example, I'm a physician. I'm giving you a protocol to treat early COVID-19. But is Health Canada recommending that? No. Is my Ontario state recommending that? No. So if you look at it from a national or a provincial level, that is not recommendation. Recommendation still is there is no treatment. So is it any surprise that when you give no treatment that you get more mortality? In my view, there is no surprise. Obviously, if you give no treatment, you will get more people in hospital. Once you go into hospital, there will be increased risk of death. So the regulation was great, in my view, for peace times. Peace times is when you don't have a war. You can be slow and deliberate. You can look at large placebo-controlled, double-blinded prospective studies. You can do a meta-analysis. You can do a systematic review. You can come up with expert opinions. You can come up with guidance. That takes years. But we don't have years to fight this infection. Last 24 hours around the world, 12,000 people died because of COVID-19. When you have over 10,000 people dying every single day of a disease, you cannot take years to formulate guidance. And that is where the developed Western, health systems, be it UK, US, or Canada, I'm afraid they've been flat-footed in their approach. And countries like India have actually done better health-wise, because they have been much more quick and nimble on their feet, using scientific evidence much quicker, and not being bound down by governments making recommendations.
Very well explained. It was very nice.
Thank you. Thank you. Well, I think we've had questions for everyone today, so that's fantastic. Again, I would recommend, please share this widely, share it on WhatsApp, share it on Facebook, for two reasons. One, if you use early treatment using our protocol, which has antiviral as well as JAK-STAT anti-inflammatory effects, then we can reduce the number of people going to hospital. And number two, if patients are made aware of this new class of drugs, which has now been FDA licensed, which can be used in patients who are deteriorating in hospital with severe COVID-19, despite blood thinners, antivirals, antibiotics, and steroids, they have a new option which could turn the situation around, which could save a life. So please share widely, and we'll meet again, same time, same place, 10 a.m. Eastern Time,